Long lines at testing sites, just one of the many frustrations people have faced during the pandemic, especially when we look back to the early days. But for the first time, you are about to have the option to maybe test yourself for COVID at home and get the results in a matter of minutes. Our Caroline Vandergriff explaining how this rapid test works and the impact it could have on maybe even slowing the spread of the virus.
No more waiting in line to get tested for COVID-19 and then waiting for days to get the results.
I think it is a game changer.
When this at-home test kit hits store shelves, people will be able to buy it for about $30 without a prescription. You can find out if you're positive or negative for the virus within about 20 minutes without having to send your sample to a lab. The FDA believes the speed and convenience of the test will help it play a major role in the pandemic response.
It just allows more people to go out and get tested. And of course, whenever you're able to identify more cases, then they're able to stay at home and prevent having contact with other people and spreading the virus.
The over-the-counter test could be available as early as January, but initial supplies will be limited. The Australian manufacturer plans to ramp up production and deliver 20 million kits to the U.S. in the first half of 2021.
As more tests come out and they become more accessible, more inexpensive, and easier to use, I think it's something that we will be adding to our prevention control measures.
Epidemiologist Dr. Diana Cervantes says this advance is an important one for slowing the spread of COVID-19, but it's not a cure-all.
We still have a longer road ahead of us in using those prevention measures, the wearing the mask, keeping that physical distancing, avoiding the crowds. That's still going to be in place for some time to come.
The FDA has previously authorized other tests that allow people to collect a sample themselves at home, but the vast majority of those require them to then send that sample off to a lab and wait for the results. Caroline Vandergriff, CBS 11 News.